This is Talk Business and Politics with Roby Brock.
And welcome to the program. I'm Roby Brock. We are glad to have you with us. The Delta variant of COVID-19 has taken a big uptick in Arkansas over the past week, so much so that Governor Asa Hutchinson is calling legislators into a special session next week to address the mask mandate, and he issued a new 60-day public health emergency. I caught up with CEO of Arkansas Blue Cross Blue Shield, Curtis Barnett, for a discussion. Just a little bit of stuff happening right now on the healthcare front. Let's begin with the governor declaring a health emergency for the second time because of COVID-19. This one's primarily to focus resources on healthcare organizations, as well as do something about the mask mandate in schools, with the special session is going to call. Does that sync up with what you're hearing from your stakeholders in healthcare?
I mean, I think so. I think we're very supportive of what the governor outlined this week. I think what it does, it puts our priority clearly where it needs to be, which is on our children. And that's the biggest concern that we're hearing from all of our stakeholders is around that. So very supportive of an effort to, move forward, more local control with regard to mask mandates, and it feels like that's the appropriate place to be.
Will Blue Cross Blue Shield be out at the Capitol pushing legislators to adopt that position?
We'll certainly be letting our position known, no question about that. These days and with everything going on, whether you're there physically or not, it's another question, but we'll certainly be letting our position known on that.
Tell me what you're seeing in the numbers when you're talking to the healthcare organizations that you partner with, the doctors groups that you partner with. What are the statistics that you're seeing that concern you, trouble you, or even maybe make you feel okay?
Yeah, Roby, I think a couple of things. I probably talk to, healthcare or hospital and healthcare system leaders, at least probably on a every other day basis, and sometimes more frequent than that. And what we're hearing from them is very consistent with what you're seeing from the Department of Health, from the governor's office, and what you're hearing directly from the hospital leadership. And that is, and also it's what we're hearing from our members as well. And so the members who we provide coverage for, we're hearing from them about, challenges with getting needed health care services scheduled because of the number of COVID cases that are there now. And in many cases, these are critical health care needs that need to be met. They've been delayed already, and so that they need to be taken care of. But the hospitals are full, and they're having trouble, getting those scheduled. I will say that the hospitals are absolutely amazing. When we reach out to them, they do everything they can to get people scheduled in. But they're worn out, they're stretched thin, and they need help.
So what can a health insurance company do, particularly one your size? What can you do to provide more resources, alleviate the stress that's on the healthcare system? Is there something that Blue Cross Blue Shield can do?
I think one thing that we've done throughout the pandemic is some of the administrative requirements that payers often have, prior authorizations, prior approvals, those sort of things, we've suspended those. And so we don't want that administrative burden to fall on the hospitals while they're in the middle of such this surge and providing this level of care and meeting these needs. And so that's a big thing that we've done, is be part of that. Others, part of why we stay in touch with them are there things that we can do. I mean, certainly we're doing everything we can through our Vaccinate the Natural State initiative to get people vaccinated. And that's what I hear from hospital administrators is keep doing that. Keep doing everything you can to get people vaccinated, and that's where our focus is.
The psychology behind that seems to be what is tripping up our rates getting up to herd immunity level there. There's disinformation that's out there. Certainly it's not something that you're putting out, but it is out there in the atmosphere that you got to contend with. And you've certainly encountered this by watching the governor's community conversations and everything. How do you get people convinced that getting a vaccine, what's the magic pill?
Oh, I wish I knew that. And I don't know that there is one magic pill. A big part of our focus has been really working with the Arkansas Minority Health Commission and going into especially some of these underserved areas. And we're sponsoring a program, working with them and the Arkansas Medical, Dental, and Pharmacy Association, which really represents the diverse healthcare professionals in our state, African American, Hispanic and others, and working with them on a speakers bureau so that there are people who are very comfortable in those communities, very trusted in those communities, who are going there and speaking on behalf of the vaccinations and really talking about those and what are the risks and what are the rewards for doing that. So we feel like having those types of relationships and having people who are trusted and known in these different communities go there and make those types of statements, we think that's key to moving this forward.
So there's certainly a lower vaccination rate among minority populations, as you're alluding to, with the fact that you're putting a big push into that, but also in the majority Caucasian community too. So how do you address that?
You know, on that, I think we just continue to work the way that we have, do everything we can to overcome. I think the medical community in particular is key to that, getting that message out, which is a big part of what we feel like our responsibility is. Continue to make it accessible. I mean, we have seen in the last couple of weeks, we saw a big drop in the request for vaccine events, and we're seeing that pick back up right now. So really in the last week in particular, a lot more requests than we had been receiving, and so we're gearing up to be sure that we can support those and be a part of those. I know other key players in the healthcare system are doing the same thing. So, we feel like the tide is turning. Is it turning fast enough? No, we don't feel like it is, but we've just got to continue to push hard as we can.
Last question on this, I promise we'll transition. Are you worried that we may not get enough people vaccinated before a variant of COVID-19 makes the vaccines ineffective?
I mean, I think we have to have that concern, no question. But I also think it's been remarkable just how effective the vaccines have been so far against the different variants. But to that point, it should give us an even greater sense of urgency because a virus is going to do what a virus does, which is to mutate. And so we've got to address this need that we have to get more people vaccinated so it doesn't have a place to mutate. So no question, that is one of the biggest reasons we should all have a sense of urgency on this.
The Blue and You Foundation, your nonprofit arm, gave $5.2 million to a variety of behavioral health programs across the state of Arkansas a couple of weeks ago.
We did.
What are you seeing in terms of the state of behavioral health and why that $5.2 million was needed?
Yeah, first, Roby, I do want to make sure that everybody understands when I use the term behavioral health, I'm talking about mental health conditions, which, like depression, like anxiety, as well as substance use disorders like opioid and alcohol addiction. So we're talking about that full range of services that make up behavioral health. I don't think it's an exaggeration to say that we're in the middle of a crisis, a behavioral health crisis. I think it's been made worse.
Pandemic related, yeah.
I think we were in one before, but the pandemic has certainly accelerated that, especially, we've seen rates of anxiety, depression, substance use, really skyrocket during the pandemic. 1 in 4 U.S. adults suffer from a behavioral health condition. About 60% of those do not receive care in a given year. Arkansas, our rates of anxiety and depression are well above the national rates, and so it's certainly a concern here as well. Behavioral health plays a major role in an individual's ability to manage their other health care conditions, especially somebody who is suffering from chronic health conditions like diabetes, like asthma, like lung disease, heart disease in particular. And I think we all know that, unfortunately, Arkansas has some of the highest rates of chronic health conditions in the United States. Someone with a chronic health condition is twice as likely to also suffer from a behavioral health condition as well. So there's certainly, those two things, they are connected. They're in a very intimate and complete way, physical health and behavioral health.
How far does $5.2 million go on that spectrum?
5.2, certainly.
It's not chump change,
no,
but
it's
not
also,
chump
change, but
I could see much more investment too.
But certainly the needs are greater. There's no question about that. But that's part of the reason that we also decided to take the approach that we did. And we're focusing in 3 areas where we think we can see some measurable progress. The first one is around prevention and early intervention. And a lot of work that's done in this space is around treatment. And certainly that need is critical. But prevention is also critical as well, because when you think about trauma, especially childhood trauma, not only can it create behavioral health conditions for the child at that time, but it can also result in those later in life as well. So we're funding grants through Arkansas Children's, through UAMS, that really address, how can we prevent trauma, or at least give better coping skills for trauma when it does occur, which is going to require that the providers be a part of that, also the families, as well as the schools and the greater community as well. So prevention, early intervention is a big focus of ours. The second one is how can we better integrate physical medicine and behavioral health, especially primary care and behavioral health. And so we've seen through our work in primary care over the last 10 years the impact that licensed clinical social workers can have when they're part of a primary care team. And there's the ability to have really a smooth transition of a patient who may be suffering from a behavioral health condition from that primary care doctor to the behavioral health specialist, and do that in a very seamless way and begin to address those needs at a much earlier stage. And so we're funding also endowments with the University of Arkansas Fayetteville, Arkansas State University, University of Arkansas Little Rock, to grow the number of licensed clinical social workers in our state and really advance that collaborative model between primary care and social workers in that primary care setting. So that's another big focus. And then the third one is stigma. And stigma is often the greatest barrier to getting behavioral health care. We want to normalize the conversation around behavioral health care and get people to recognize, both those who may be suffering from a condition, but also the greater public, to realize that it's not just a personal weakness, it is a disease that needs to be diagnosed, it needs to be respected, and it needs to be treated.
Does the issue of stigma, is it helped by the fact that Simone Biles kind of admitted that, hey, I struggle with some things that compound my situation emotionally and
Yes,
mentally?
I mean, I don't think there's any question about it. I think her recent experience will bring even greater attention to that. And I'll tell you, Roby, we've spent some time and even focus groups in the last couple of years with especially young adults, 25 and below, talking about a range of healthcare issues. And we had about 25 individuals in that age range together a couple of years ago and talking about all these things. And the one issue where everyone in that room spoke about and spoke passionately about was behavioral health. And so, to me, some of the greatest hope comes from a generational change that we're seeing, especially young adults and those who are in high school today.